Good morning, doctor and friends. Now we are present about our student project about desk diet. Okay, next. So this is our member group from SGD 2. Okay, next. So I will present about introduction of student project. First, in Indonesia, hypertension has become the most common disease in the community. Over one-third of the population in Indonesia has hypertension and two-thirds of the population that get treated have uncontrolled blood pressure. Hypertension has many complications such as chest pain or angina, heart attack, heart failure, and irregular heartbeat. We need to control hypertension with another way, like a healthy diet, beside of hypertension medicine. The word diet is often associated with weight management. Reasons are to prevent weight-related diseases such as diabetes and heart disease. But diet can also be used to maintain our blood pressure, especially for hypertension patients. Hypertension patients often eat unhealthy foods such as excessive salt consumption, diet high in saturated fat and trans fat, and low intake of vegetables, which can lead them to another disease related to their hypertension. One of diets that can stabilize our blood pressure is DAS diet. DAS, our dietary approaches to stop hypertension, is a program to promote consumption of vegetables and fruits, lean meats and dairy products, and micronutrients in the menu. The one concern of this diet is sodium. This diet also concerns the low saturated and trans fat, rich in potassium, calcium, magnesium, fiber, and protein. Okay, next. So this is our problems of this research. Next. This is our objective of the research. Next. This is the benefits of our research.
So the next is description. So hypertension is one of the most significant causes of premature mortality and morbidity worldwide. This is because an increase in blood pressure adversely affects cardiovascular and renal outcomes. So the treatment of this disease can be done by taking medication or changing the lifestyle of someone. Hypertension medication can be divided according to how they work, including diuretics, beta blockers, alpha blockers, ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers. On the other hand, one way of changing the lifestyle can be done with diet. The dietary approaches to stop hypertension, or we call it DAS diet, is a form of diet that is believed to be effective for lowering blood pressure. So the DAS diet plan is focused on heart health and there is therefore set to limit fat intake, especially saturated fat and trans fat. In addition, this diet also focuses on foods rich in nutrients that can lower blood pressure levels. Usually, the foods consumed are foods that are low in sodium but rich in other minerals, including potassium, magnesium, and calcium. So, the DAS diet meal plan is a diet rich in fruits, vegetables, low fat, or non fat dairy products. DAS diet aims to reach 2,000 calories a day, and the nutritional profile of these diets included total fat is 27% of calories, saturated fat is 6% of calories, protein 18% of calories, carbohydrate 55% of calories, and cholesterol is 150 milligrams.
This diet was started in 1990s. The National Institute of Health began funding several research projects in 1992 to see if certain dietary interventions were useful in treating hypertension. This diet was first introduced in American Heart Association meeting in 1996 and then published in New England Journal of Medicine in 1997. Recommended by National Heart, Lung, Blood Institute to lower blood pressure with a diet rich in fruits, vegetables, and low-fat dairy with a reduction in total and saturated fat. It was found to be better for people with high blood pressure with a reduction in systolic and diastolic 11 and 6 mm of mercury. In the last 50 years in the United States, there has been an increase in hypertension, diabetes, obesity, and coronary artery disease. About 30% of US adults have hypertension. Fortunately, the risk factor can be controlled using the DAS diet.
So the next one is the purpose and benefit of DASH diet. Several studies have shown that the DASH diet makes a difference in lowering blood glucose levels, triglycerides, LDL cholesterol, and insulin resistance. DASH diet is an effective instrument in weight management, help to control type 2 diabetes, help in reduction in the frequency of colorectal cancer, chronic liver disease, diverticular disease, and celiac disease, and also lowering the all-cause mortality in adults, lowering the rates of heart failure in women, and consequently reduce the prevalence of hospitalization from heart failure and death in men. When compared to a few other diet patterns, the DASH diet has an included advantage of having clear rules on the serving sizes and food groups, and which make it simpler to prescribe and monitor the patient's improvement.
The next one is hazardous consideration and or side effect. When starting the diet, some people might experience bloating due to the content of high fiber, which comes from fruit and vegetables. Some features of the DASH diet might cause an impact of the risk of stone, as the diet is rich in calcium, so that could increase levels of dietary calcium. It is associated with risk of kidney stone formation. The other risk is calcium oxalate nephrolithiasis, which happen because oxalates are concentrated in excessive amount in this diet. They come from intakes of nuts, fruits, and vegetables that increase the excretion of oxalates in the urine.
The DASH diet recommends that people eat no more than 3/4 of teaspoons, like about 1,500 mg until 1 teaspoon, about 2,300 mg of sodium per day. There are some concerns that eating too little salt could affect heart problems, such as increased rates of heart disease, insulin resistance, and fluid retention. However, it is still unclear whether there is any benefit to reducing salt intake this low, even in people with high blood pressure. Next.
People with progressive kidney disease may need to restrict their potassium intake. Potassium intake needs to be highly regulated if an underlying chronic medical condition such as chronic kidney disease is present or prescription potassium is taken. Hyperkalemia can occur in people whose potassium excretion in the urine is compromised, which in turn can lead to cardiac arrhythmia, one of the most dangerous conditions that can happen. Another factor to closely observe when switching to DASH is the presence of diseases or disorders that require a specific medical nutrition therapy or MNT. These include celiac disease, lactose intolerance, or allergy. Owing to the high fiber content of plant foods, including fruit, vegetables, and whole grain, bloating and gas are some of the common side effects. This can be avoided by introducing 1 or 2 fresh high-fiber food every week rather than all at once. It is also necessary to drink more water at the same time, as fiber pulls water from the intestine.
It is safe to say that DASH can be a very useful tool for physicians to tackle diabetes mellitus and high blood pressure more efficiently when combined with pharmacological intervention. Compared to some other diet patterns, it has the added advantage of having clear guidelines on the serving size and food groups, making it easier for the physicians to prescribe and monitor the patient's improvement. DASH diet could be useful not only in the prevention of gout and its comorbidities in high-risk patients with hyperuricemia, but it is also useful when urea-lowering drugs are not yet indicated in patients with gout. Moreover, even when such drugs are indicated, the DASH diet would serve as a useful adjunct therapy to improve cardiovascular comorbidity profile of the patient. Finally, many patients with gout prefer non-pharmacologic options for treatment, according to the recent survey by the Gout and Uric Acid Education Society.
The menus following the DASH diet principle contains of foods that are low in saturated fat, cholesterol, and also trans fats. The food contains more whole grain foods, fruits, vegetables, fish, and also nuts, based on the limit of 2,000 calories a day and focus on a maximum of 1,500 until 2,300 mg sodium. Here are the menu for the breakfast. We have 1 slice of whole wheat bread with 1,049 mg sodium, plus 1 tablespoon of peanut butter with 81 mg sodium, 1 piece of medium-sized banana with 1 mg of sodium, and also 1 cup of low-fat milk containing 107 mg sodium.
So now for lunch, we're gonna have brown rice as a carbohydrate for a cup. For protein, we can get roasted skinless chicken breast for 3 ounces, and you can add canola oil and barbecue sauce for a tablespoon each of it. For vegetables, you can eat 2 pieces lettuce leaves and 4 slices baked tomato. And for fruits, you can eat medium-sized orange for a piece and last, mineral water for 1 until 2 glasses.
For dinner, we arranged the patient to have 3 ounces of spicy baked cod with 1 tablespoon of canola oil for a total of 70 milligrams of sodium. For the carbs, we arranged the patient to have baked potato for exactly 1 piece, with chopped scallion stock 1 piece, 1 tablespoon of fat-free sour cream, 1 tablespoon of natural cheddar cheese, reduced fat and grated, and a half tablespoon of mustard. Sodium levels are listed on the right side. For the veggies, we urge the patient to have 1 bowl of spinach salad with fresh spinach leaves for exactly a cup, with a quarter cup of grated fresh carrots, quarter cup of sliced fresh mushrooms, and 1 tablespoon of vinaigrette dressing. Also, we urge the patient to have 1 piece of cookie for 60 milligrams level of sodium, and 1 piece of medium peach for 0 level of sodium.
As a conclusion, DASH diet is a form of diet that is believed to be effective in lowering blood pressure. DASH diet is rich in fruits, vegetables, low-fat dairy, with a reduction in sodium, total fat, and saturated fat. For history, DASH diet is started in the 90s by the NIH, first introduced in 1996, and then first published in 1997. Purpose and benefit of this diet are lowering BP, blood glucose, triglyceride, LDL cholesterol, and insulin resistance. Hazardous consideration of this diet is that it can increase the risk of kidney stone formation, calcium oxalate nephrolithiasis, heart disease, insulin resistance, and fat retention. Next.
Special precaution for DASH diet is to avoid bloating and gas by introducing 1 or 2 high-fiber foods every week, and avoid constipation by drinking more water. Suggestion: DASH diet can be used to tackle diabetes mellitus and high blood pressure, prevent good, and improve cardiovascular comorbidity profile. And for the sample menu of DASH diet, such as for breakfast, whole wheat bread, banana, and low-fat milk. For lunch, there's brown rice, chicken breast, lettuce leaves, baked tomato, orange, and mineral water. And for dinner, there's spicy baked cod, baked potato, spinach salad, cookie, and peach. And for the snacks, there's low-fat milk, dry apricots, and unsalted sunflower seeds. That's all for our group student project presentation. Thank you for your attention.